Hi everyone. We have covered the basics of air conditioning and waterproofing in our previous 8 videos. We were trying to work on the services, but now today we shall not discuss services in general. We have a guest with us. He is a PhD in hospital planning and healthcare. Let me introduce you to Dr. Anil Dewan from School of Planning and Architecture. Welcome, Professor Dewan. First, let me thank you for giving me your precious time. Though everyone is aware of the tremendous knowledge you have on the subject of healthcare, but today I want to ask some very simple questions which were conveyed to me by one of my interns. My first question is given to me by Miss Mani Varshini. She asked me last month whether she should take up a multi-speciality hospital for thesis or a cancer hospital. What is your take on this?
Hi Anil, thank you for having me here. It's a pleasure to be here with you. And more so because I'll be addressing the issues to the concerns of the interns and freshers. So let me start with your first question. A multi-speciality hospital treats all organs and all systems, while a cancer hospital is dealing with one system and the subsystems of the human body. This is a cancer hospital has more of radiation protection, it has got technology and it has got equipment. So in a multi-speciality hospital, cancer could be one of the many specialities. So if you do a multi-speciality hospital, you do cancer also. But when you do a cancer hospital, you do more of radiation protection, equipments, and radiation, medicine, and surgery related to cancers.
But the basics remain the same.
The basics and the fundamentals and the first principles are the same for both of them.
So her learning process is not going to be altered either this way or that way.
Yeah, it does not matter. The learning, the principles, and the fundamentals are same for both of them.
Okay. And how do you think she should start her research on this subject?
So we at SPA ask our students to have a detailed requirements or a program, a site, and the development controls on the site before they start doing a thesis project in the thesis semester.
You mean to say they do some kind of dissertation or something?
Yeah, they do a thesis semester wherein they study the theory of hospital design, or they do a research question on what is healing environments, or what are patient-centric hospitals, or what are what we call as those hospitals which follow the dictum of evidence-based design.
Okay, and this is the general trend followed everywhere or at SPA?
This is what we do at SPA because it takes 6 months to understand the things. So if you have a 6 months thesis semester, you cannot do justice to the subject.
Correct. Now, as a study on this topic, which are the best hospitals to study and which are the worst ones to study?
So if we are in Delhi region, we say Safdarjung Hospital is a worst example to study because it was an American barracks which was in the 1940s, and then all the open space that was available was filled up for various departments whenever whatever came up. So a good hospital done by a sensitive architect like Sitaram Bharatiye could be a good example to study.
Even AIMS?
AIMS in Delhi is not a good example because it has expanded too much, and again all the open spaces.
It has not been made in one go.
No, it's not been made in one go, and we say that whosoever became the director had the expansion. So the eye director did a eye hospital there, and orthopedics director did too much of expansion in orthopedics. So whosoever became the director would develop his specialty too much there. So
Okay.
now there are too many independent hospitals within hospitals in AIIMS. So it's far too complex for anybody to
Long
understand.
back you had mentioned about AIMS Jhajjar also.
Yeah, AIIMS Jhajjar is the NIC, is the National Cancer Institute. So it's a super specialty cancer hospital. So somebody, if he wants to study a cancer hospital, AIIMS Jhajjar is a very good example.
Okay. And the students have a genuine problem. How can they have access to the plans of these hospitals in order to understand good or bad design?
See, plans of the hospitals, if you go to do a case study, in each of the case studies, there is a fire evacuation plan. So you could go and click those fire evacuation plans. Ideally, you should go to the architects who designed these hospitals, and the architect should be ready to give
But
their
generally, that is
drawings
not
to
the
the
case.
students.
Generally, that is not the case. They don't give the drawings.
So we have a network of the senior students who've done case studies, and the junior students go to their seniors and get their drawings. But maybe through you, if they come to us, we may be able to help them with
Nowadays,
whatever drawings
there's
we
a
have.
genuine problem. Like people can't travel, and they can't come to SPA2 because of the COVID situation. So, how do they access these drawings? Can't we have some kind of a system where everybody can access these drawings?
So actually there are non-disclosure agreements. The architects are bound by their clients, by their agreements wherein they say we will not disclose your drawings to anybody else. Then there are proprietaries, copyright issues, and so all these things make it very difficult for architects to share their material with others. Imagine now clients are asking architects that even in your office you will not display our drawings.
Okay.
So this is the kind of agreements which architects have to sign with their
Okay.
clients. So their hands are also tied now.
We also have a problem like what kind of standards and which standards, hospital standards, should the students follow for hospital design?
Oh yes, now we are very lucky that in India we have a lot of standards. So first is the National Building Code. All the students should follow the basic building requirements from the National Building Code. So we have performance based standards also coming up. Then we have the BIS or the ISI standards. Then they can Google IPHS standards, Indian Public Health Standards. Then we have Health Facilities Guidelines for India and International Health Facilities Guidelines. They could also Google room data sheets, and there are 450 types of rooms in a hospital, and the room data sheets gives you the floor, the ceiling and the four walls, what are the services, what are the medical gases, electrical, air conditioning, finishing, all the requirements.
Okay. They also have one more problem. In designing city center hospitals, generally students ask me what is the ideal minimum bedded hospital in case of a cancer hospital or in case of a super specialty hospital.
Yeah. So, number of beds to the amount of care or the type of care which a hospital could do is an old concept. So, today what we have is what are the treatment modalities, what is the throughput, what are the services you can offer
You mean
in
to
a
say
hospital.
daycare and all that?
So what we mean is that we could have ambulatory care, short stay care, day care. So within that a person may be admitted for a short duration and you could perform a dialysis procedure, a radiation therapy or a daycare neurosurgery also. So you admit early in the morning, get the surgery done and by late evening you get discharged.
There is a insurance problem in daycare. How has that been sorted out?
Oh yes. So because of this COVID situation, the insurance companies are also now encouraging home care. So we have ICU at home. So home care standards are being developed by India. The insurance companies are also now agreeing to fund you for getting treatment from your home for short stay, and they are not insisting that you be inpatient and get all the tests, all the diagnostics and all the treatments done by inpatient. So they are also seeing that the patients are reluctant to go to hospitals and to stay for longer durations because it's not safe.
Correct.
Because of the infection situation we have.
Correct. Students often also ask, how can a good design reduce the cost per bed in the construction of the hospital?
Yes. So what we have to see and understand and make the students understand is that we should think of the total life cycle costing. So
What do you mean by life cycle?
what we mean by life cycle costing is the operations cost, the maintenance cost, and the cost of owning that facility. So how much air conditioning are we needing, the electrical, the services, the medical gases, and the finishes. So if it is a hardy finish, if it will last long, then maybe even if the initial cost is a little higher, that should be
You mean
acceptable.
to say the running cost should be less?
The running cost should be less because the operation cost is daily recurring expenditure and the capital cost is initial expenditure. But we understand that in India the capital cost is very difficult to get and there are cost overruns, time overruns with most of our hospital projects.
Do you really believe that a good hospital environment can help the patient heal better and faster?
Yes, there have been studies which prove that good healing environments you require lesser painkillers, lesser antibiotics,
Okay.
and the outcomes are better and faster. The patients recover faster, the average length of stay is reduced. It has been proved now by studies.
We had once discussed in SPA that should a hospital be patient centric or doctor centric? What is your take on this?
See, AIIMS in Delhi once upon a time was designed to be friendly to the professor, to the faculty. So, suppose we take the orthopedics department example. So, for Professor Dave, his director's office, his teaching block, his physiotherapy, occupational therapy, his studios where he used to shoot, his operation theatres, the AB ward and the private ward were all saving steps for the professor.
Okay. So
But
it was
now
doctor centric.
it was doctor centric. But now hospitals are friendly to all stakeholders. They should be good to the patients first, to the relatives, to the attendants, to all the other stakeholders, nurses, doctors, visitors, and everybody else who comes. So it should be good to look at from outside also.
There's a kind of belief that a spread out hospital is not really a good idea. Do you think a hospital which is compact is better than a spread out hospital?
See, once upon a time we used to have a lot of site, lot of area, and we could do spread out hospitals. But now in city center hospitals, we have a podium and a tower on the podium. So in these designs, we get more FAR, more ground coverage and more usable areas. So the efficiency of design is a little better.
Actually, students think of hospital design as a very complex subject. So, in order to identify and simplify it, how should they go about in starting their design process?
Okay, very fair. So first they should see the standards, they should see the relationships within the department and interdepartment relationships. So then if they see that in the third dimension also, which is in a section we see the stack diagram, what are we having below the ground, where are the services, where are the parkings, where are the hospital support, the utilities and the patient areas. So the rooms with the views should go to the patients where patients are in their rooms, and all other areas should be functionally very well interrelated.
There's a very common question. What things should go in a basement?
In a hospital, as per the bylaws of India, areas where patients are staying 24 hours, they cannot go in the basement.
Okay.
All other clinics, diagnostics, treatments, services can go in the basement. But if you have a kitchen in the basement, then you have to have a sunken coat and the atmospheric
Because the
pressure
gases and all.
because of the heavier than air LPG gas and the evacuation of fire protection and all those things. So risks are very important to be taken care of.
One of the very important function which I think important element is that as an architect is form important of function in a hospital.
In any building, architects are very keen to see that the form is good from outside because they are more keen on that. But hospital is a very complex building and it is complicated. So the function and the functional relationships to be satisfied properly are very important in a hospital because these are lifeline situations. So an emergency block should be visible from the entrance and it should take minimum time to reach the emergency.
Correct.
We've heard people saying, gate tak to theek tha ji, ab thanda ho gaya. Which means the person from the gate to the emergency couldn't survive.
Okay.
So few minutes, few seconds here to there are matters of life and death. So for these lifeline situations, the functional relationships first and then form is very important.
I have realized after entering, and one of my relatives stayed at Apollo, they have a very strong form. Apollo has a very strong form, Delhi Apollo. So from inside, they have huge problems. Even there is no window for the ICUs. The windows, round windows for the rooms, they don't work. People feel suffocated. The patient feels suffocated. What is your take on this?
Well, it's a celebrated architect doing celebrity buildings, so he was more form from outside. A room with a view for a patient room is very important. So those round windows for a patient room are not acceptable. And ICUs should orient the patients properly. So which means an ICU patient should
Also
be
should have a
able
window.
to see whether it's morning, evening, day or night. The orientation should be there for an ICU. So we say that there should be light, there should be good light. The patient is always horizontal looking up. So maybe there's light from up there. Daylighting is very important for ICU.
So in such a condition, a spread out hospital is much better.
Yes, much better. But if we have the site, if so, city center hospitals may not be very difficult to do that. But if we have peripheral or we outside the city centers, we should do as far as possible spread out hospitals.
We have actually answered the common questions for interns, but now I want to ask some general 2 or 3 questions. One is, why is good health care not being provided at the village level? Will that not reduce the rush to the city hospitals?
See, the problem is it is not viable. The number of patients, the patient loads, the paying capacity of the peripheral villages, small towns is not there. So, no good private player is ready to go to the villages. So, at the peripheral level, we have only the public sector working. But in the public sector also, doctors, nurses, and other staff are not ready to go to far off locations
Because of their
their
families staying.
children's education and all other things, quality of life and those things. So now with PPP models, the Ayushman Bharat scheme and some things with better connectivity.
Is that a public-private partnership?
Yeah, in that government is now from service provider, it is turning into seeker of services. So the government will say, we are going to pay this much per procedure or for this thing and you provide the services and we'll maintain the standard.
So can't the government help in the sense that provide land and other facilities where the private players make the hospital, and then it's a mandatory for them to give free treatment for the poor?
Yes. So the private players are asking for rates of electricity, water supply, and in the building development controls, the land be given to them at a lower rate, and the FAR should be higher, the ground coverage should be more, and there should be some viability gap funding and things like that to make the hospitals viable for them.
Profitable for them.
Profitable, workable. So the rates as of now are not workable.
Okay. Now, as an authority in healthcare design, what do you see the future of healthcare in India?
the future of healthcare in India is very bright. Why is it bright? Because we are providing health manpower to rest of the world. So in all these hospitals, we will train the people, we will train the doctors, nurses, paramedics, and all other kinds of health service providers, and they would not only work for India but all the other countries of the world. And architects will get a lot of opportunity to design all these facilities because the numbers and the unmet need is mind boggling in India. So the access to healthcare as of now is not there, and it is bound to come.
I have to thank Dr. Dewan for sharing his ideas on hospital planning and helping the students generally for understanding this subject better. We urge all students to note down the mail ID given below and send your queries. Dr. Dewan shall be more than happy to answer to any of your doubts. We shall keep arranging with prominent specialists. We shall keep arranging some meetings, talks in every field. Thank you once again, Dr. Dewan. I hope all of you found this talk very interesting. We shall be back with other experts. Till then, bye. Take care.